Welcome to Bringing Better Health to Life, brought to you by Conway Medical Center. My guest today is Dr. Joseph Edelson. He is a gastroenterologist with the Conway Physicians Group, and we welcome you to the show.
Thank you, Diane. I'm so pleased to be here.
I'm anxious to find out about you. Tell me all the things I need to know before you got to Conway.
Diane, I've led such an incredible and exciting life. And it's very interesting how it all sort of ended up here in Conway, because Conway is almost a microcosm of my life. I was originally raised in the New York City area, went to undergraduate college at Franklin and Marshall in Lancaster, Pennsylvania, and then attended New York Medical College in Valhalla, New York. Interestingly, one of the medical students who studied with me in New York Medical College was Dr. Richard Eisman. So here we are together 30 years later. After I went to medical school, I went into the United States Army and had a marvelous time. I trained at Walter Reed Army Medical Center, doing both my internship, residency, and fellowship. And interestingly enough, Diane, one of my interns at Walter Reed, Dr. James Adamson, is on the staff here at Conway Medical Center.
So you're home.
It's definitely home. I felt very warm when I came to Conway Medical Center. In the Army, I served our country overseas. I spent a year in Korea, had been in Germany. Actually, I married an active duty Army dentist and had a few Army brats.
But that's why you have great teeth, too.
That's why I have great teeth. They're straight. They're straight. After my service, I went to Atlanta, where I practiced for several years, then came to Conway via Anderson, South Carolina. It was very interesting, even though I had been away for so many years. When I hit Conway Medical Center, I saw my entire past here. There was Dr. Eisman, there was Dr. Adamson, and Dr. Hank Saunders, who was in the Army, too. So I knew there was no hiding of any secrets when I came to Conway. Everyone had known me from so far back. It's a very warm and loving place.
Tell me about your practice. You've already mentioned Dr. Eisman's there with you, but tell me a little bit about the things that you do. And I understand you need to brag about the beautiful new Endoscopy Center.
Well, you know, Diane, gastroenterology comes from three ancient Greek words. There's gastro, meaning stomach, enteron, intestine, and logos, meaning reason. And we study the digestive system from the mouth to the anus. Luckily, here at Conway Medical Center, we also study the hepatobiliary system. And by that, I mean we study the gallbladder, bile ducts, and liver.
And I understand, by the way, that's your specialty.
That's part of our specialties here. And we're very fortunate to have a most wonderful, wonderful endoscopy center. In fact, having been around the world, I can unequivocally state that our endoscopy center here at Conway Medical Center, if not the premier center in South Carolina, is one of the finest centers in the country.
I understand not only is the facility lovely and comfortable for people when they come in with low lighting, but it's also got some of the best cameras, so you can really see everything perfectly.
Yes, we have high-definition TV. All the equipment is new. High-definition TV means that we can see lesions that are very small. We see them clear, and that also shortens the examination time. The other thing, Diane, that I found particularly wonderful about our endoscopy center is that they manage to give dignity to the individual. So many times I've had patients come to me from other centers in the area saying that they were herded in like cattle. The time they saw the doctor was when they had the procedure, and then they never saw them again. Here at our endoscopy center, we have individual rooms. You're met by a nurse who goes over the procedure in addition to having seen us prior. And then also, once you have your procedure, that's not the end of it. You come back to us and we go over what we've seen and answer any questions. Actually, here at Conway Medical Center, it's not only treating illness, but it's also promoting health.
Wonderful. Well, that's a great place for a break. But when we come back, I want everyone to know we are going to talk about colonoscopies. What age should you have them? What is the process? And God forbid they find anything, how is colon cancer treated? We'll be back in a moment.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
Here on Bringing Better Health to Life, I'm talking with Dr. Joseph Edelson. He's a gastroenterologist with the Conway Physicians Group, and we want to talk about colonoscopies. What's the age now?
I tell you, Diane, endoscopy is a very unique test. You know, it's one of the few tests where we actually go into the organ to look for disease states and things that we can therapeutically take care of. Colonoscopy, as you know, is a colonoscope is a tube with a line on the end of it. And while you're gently sedated, we insert the tube in your rectum and we look through the entire lower GI tract or colon. What we're looking for are polyps. Those polyps are little growths that oftentimes can be precursors to cancer. Most colon cancers in the United States occur after the age of 50. So we recommend that patients start their screening after the age of 50. However, there are special groups that we recommend earlier screening. One of these special groups are African Americans. We recommend African Americans begin screening at age 45. And we also recommend that if you have a family history of colon polyps or colon cancer, that you begin screening before the age of 50, depending on the history in your family.
And then how often should you have one?
It basically depends on what we find. If we find a polyp, we recommend repeat colonoscopy every 3 to 5 years. If we don't find any polyps, the current recommendations are every 10 years. However, of course, there's a caveat with this. If within the time period that you're being observed, you develop what we call alarm symptoms or warning symptoms, we recommend you rush in and have another one.
And what are some of those?
Some of these alarm symptoms are bleeding, change in your bowel habits, severe abdominal pain, weight loss, or a change in some of your laboratory parameters like anemia, if all of a sudden you develop what we call iron deficiency anemia. Again, they're called alarm or warning symptoms because, Diane, they can be harbingers of bad things to come.
Having had a colonoscopy, I'll have to buy what all my friends told me about it, and that was the fact that the colonoscopy was nothing. Don't even remember it, wasn't the least bit painful. The prep can sometimes just be annoying because of the taste of the product.
Well, you know something, Diane. A colonoscopy is really like Chinese food. It's all in the preparation. Having been doing this for over 30 years, I must admit that the preps have really improved since the first ones that we had. At Conway Medical Center, we try to tailor the prep to the individual. When we interview you, we go over the different options available, and we try to individualize the prep and match up a prep that you would be comfortable with, and more importantly, one that you'll do.
Got to come up with one that tastes like chocolate. I think we could get rich doing something like that. I want to talk to you too about if God forbid you find out later that you have colon cancer. A lot of progress has been made in that area. What are some of the treatment options?
Okay, well, tremendous progress has been made. First, I must mention, Diane, the very fact that you have a colonoscopy improves detection rates and improves your risk of colon cancer. If you have a colonoscopy, odds are that if you do have a colon cancer, it'll be picked up earlier and the treatment may simply be just removal of the polyp or light tumor there. If not, we have wonderful surgical options and wonderful chemotherapy options. The progress in colon cancer is perhaps one of the great stories of our treatment of cancer over the past few decades.
If caught, can be cured.
It can
Good
be
news.
cured.
We have about a minute and a half to go, and I don't want to miss a chance for you just to talk a little bit about some of the bile tests, because you're doing something at your practice that normally patients had to go to Charleston to receive.
That's right, Diane. I do a test known as endoscopic retrograde cholangiopancreatography. It's quite a mouthful.
I'm glad you
isn't it?
said that.
So we just mentioned it as ERCP. I was very fortunate, actually, to be at the start of when this procedure became popularized almost 25, 30 years ago, Walter Reed, and have seen it progress to the point it is now. So I have a lot of experience in this. Unfortunately, it's a very difficult test for a physician to do, so there aren't many physicians who do it. I feel blessed that I have the technique and the training to do it. In the past, you know, if patients needed that test, they had to be transferred over 2 hours away to Charleston. But now we can offer the test here at Conway Medical Center. Not only can we offer the test, but in our brand new endoscopy center, new rooms have been built specifically for the test. So I'm very, very pleased to be able to offer that service to the Conway family.
That was excellent. I just thank you so much for great information, and thank you so much, Dr. Edelson, for sharing with us.
I appreciate you giving me the opportunity to speak to you, Diane, and to speak to all the viewers who are looking in on our web broadcast today.
Thank you so much.
Thank you so much.